So my name is Jag Dander. I'm a consultant maxillofacial head and neck surgeon at Queen Victoria Hospital, East Grinstead, and also at Brighton and Sussex University Hospital. I'm a clinical reader at the university as well. I'm an academic surgeon and I'm an implant surgeon. So a dental implant is a technique for replacing missing teeth. It's a fixed technique. So what I mean by fixed is that when we place a dental implant and we screw the crown over the top, it's not something you have to take in and out. It's a technique that involves a little bit of surgery, but it has very good overall success rates, and for those patients who struggle with dentures and don't want to consider a bridge option, it's a great way of replacing missing teeth. When we first see a patient for a consultation and assess the suitability of a patient for dental implants, we're often thinking about the factors that can adversely affect outcomes or success rates. And those factors can be medical factors like diabetes, for example. They can be smoking factors. Certainly good evidence that smoking can limit or reduce the success rate of implants. And then finally, oral hygiene. So if we have a patient who has a combination of two or more of those, then we're often a little bit anxious. My strategy is to try to control as many of those factors as possible. So oral hygiene to be improved and optimised. When we have patients who smoke, lots of help and advice on reducing smoking. It's not prohibitive, and I've placed implants in plenty of smokers historically. Oral hygiene has to be immaculate, and then of course a well-controlled diabetic as well. So an implant shouldn't be painful. The initial part of the treatment is to numb you up with a local anaesthetic, and we can use gel as well to make that as painless as possible. The process and the procedure of placing implants after the anaesthetic is in should be completely pain-free. I have a very low threshold to want to encourage patients to tell me when things are uncomfortable, and I would want to treat them how I'd want to be treated. So once the anaesthetic's in, no pain. You don't always need an implant for every tooth missing. There are lots of ways that we can use implants to replace your missing teeth. If you have a single tooth, we can place an implant and provide you with a single crown. Sometimes if you have 2 or 3 teeth missing, we can support those 2 or 3 teeth with 1 or 2 implants. We also use implants to help stabilise dentures. So if you have an existing denture which you're struggling with and it's mobile and poorly retentive, implants are a great way of increasing the stability and the retention of the denture, which would enable you to eat whatever you wanted with confidence. As a qualified doctor and a dentist, I'm also able to offer sedation for the nervous patient. If you're anxious of the procedure, we can give you an intravenous injection which would help to calm you, and the only prerequisite is that you have somebody bring you in before surgery so that you have somebody to escort you home. The evidence in the literature for the longevity of implants, a lot of these studies are what we call heterogeneous, which means they have quite a mixed bag. The success rates of implants at the front of the top jaw, for example, will be different to implant success rates at the bottom jaw at the back because the bone quality is much better. We've talked about patient factors that can influence success rates and the hygiene as well. As an overall figure, 90% of patients will be having their implants still there 30 years into their placement. Sometimes the crowns will need replacing and they can be chipped, but that's quite an easy thing to do with implants. It's just a matter of unscrewing them and then repairing them and then screwing them back in. The first stage of treatment would be a consultation. A consultation normally takes about 30 minutes, and during that process I would assess the mouth and assess the amount of bone present with x-rays and CT scans if required. We discuss all the options and alternatives for replacing missing teeth, not just the implant option. And then that consultation will be followed up with a treatment plan letter that you receive a few days later. So if you're happy to proceed, you send the letter back and we will book you in for a 1-hour appointment if it's a straightforward single implant. That 1 hour often involves 15 minutes to set up and 15 minutes to discharge, so the actual surgery can be completed in 30 minutes. The surgery involves a local anaesthetic and injection, and it shouldn't be painful. Once I'm happy with the surgery and we've placed the stitches, which are often dissolvable, we will then discharge you, sometimes with antibiotics if indicated. Often for a simple straightforward implant, I'd expect pain, post-operative pain and discomfort for perhaps 24 hours, requiring paracetamol or ibuprofen. We then wait for a 10-week period for the implant to integrate. And at 10 weeks, we'll bring you back in and assess that integration. And by integration, I mean the successful healing of bone into the titanium implant. If the implant has integrated, then we will proceed with the restorative phase, and that means that we start to think about the construction of the crown. So we take an impression a few weeks later, and then 2 weeks after that, we'll be able to screw the crown into the implant.